So, welcome everyone to this afternoon's anti-racism policy panel, where we will be discussing how to develop strategies for scaling and adapting anti-racism policies and practices to different contexts within nursing and healthcare. We are here today, all of us today, with Holly Murphy, Dawn Googoo, and Janet Montague, and they will be introducing themselves and sharing their backgrounds and telling us about their relationship with anti-racism policy work. So I will hand it over to the three of you. Who would like to go first? Holly, do you want to go first?
Sure. Thanks, Valerie. Hi, everyone. I'm Holly Murphy. My pronouns are she and her, and I'm very honored to be with you today, and also wanted to let you know a little bit about myself. I work as Advanced Practice Leader of Trauma-Informed Care at IWK Health, and want to acknowledge that I am in Mi'kma'ki, traditional and unceded territory of the Mi'kmaq people. We're all treaty people, and I also want to acknowledge in the province of Nova Scotia that it has a long history of over 400 years of African Nova Scotian significant contributions to our province. I'm a settler of Irish and Scottish descent, and within my role as Advanced Practice Leader of Trauma-Informed Care at IWK Health, it involves a lot of looking at how we create safer spaces, relationships and environments, promoting physical, psychological, and cultural safety, which includes an environment of anti-racism as well. And I also want to acknowledge my white privilege and that I have a responsibility both personally, professionally, and organizationally, to learn, grow, and take action. So very grateful to be with you here today.
Thank you, Holly. So how about Dawn goes next?
Hi, everyone. My name is Dawn Googoo. I am a Mi'kmaq registered nurse from one of our 13 communities in Nova Scotia, also in Imagi. And so my background, I grew up in my community, about 1,000 members. I have 7 sisters, so I have a range of learning to deal with people, I guess, and different personalities. And I feel like actually that was an asset that helped me to move through life. And so I left my community when I was 19. So I've now been living away off my community now more than I've lived in my community. And I still learn so much and, trying to live both in both worlds and, trying to learn to be comfortable and confident in both worlds. So thank you.
And I guess I'll go next. Hi, everyone. First, I want to thank CNA for the invitation to be a panel speaker, and I am honored to be presenting alongside Holly and Dawn today, and also thank all the attendees for being here. So my name is Janet Montague, and my pronouns are she and her. I am joining you from Whitby on the traditional lands of the Anishinaabe, Wendake, Neowensho, Haudenosaunee, and the Mississaugas. I am a nursing professor at Centennial College, and I teach in the collaborative BSN program with Toronto Metropolitan University and George Brown College. I'm also a PhD candidate at Western University, and my doctoral dissertation explores Black students' experiences of belonging through the lens of critical race theory and intersectionality. Beyond my dissertation work, my interest includes championing anti-racist pedagogies, student transition, mentorship, and promoting student success. And I'm also involved in a number of volunteer activities and committees. So I am very honored to be here with you today. Thank you.
Thanks, Janet. So maybe we start with Janet. So this first part of the session, we have 4 questions, and we've kind of provided the time allocation that we'll have each panelist provide 2 to 3 minutes in a response. So maybe if you can dig a little bit deeper on what your relationship to anti-racism policy work is.
Thank you, Valerie. So first, what I'll probably do is to just provide a couple of definitions that have helped me understand my work around anti-racism policy. So the National Commission to Address Racism in Nursing defines policies as a set of ideas or plans that guide programs or thinking at the organization or government level. They're ever present in our daily lives, guiding or putting boundaries around our actions and decisions and home and most certainly in the workplace. Dr. Abraham Kendi also defines anti-racism as a powerful collection of policies that lead to racial equity and justice that are substantiated by ideas of racial equity. So in hearing these definitions, I'll say that my relationship with anti-racism policy work is multifaceted and rooted in my professional career as a nursing educator and scholar and my commitment to social justice and equity. So throughout this panel presentation, I will be sharing my answers mainly in the context of nursing academia. So as a scholar and educator, I have witnessed firsthand how structural racism influences every aspect of education and healthcare. And this understanding drives my ongoing research and advocacy focused on a sense of belonging and anti-racism in nursing education, exploring how institutional racism manifests in daily interactions, curriculum design, and professional development opportunities. So through my role, I work on revising and developing curricula that are inclusive, culturally responsive, and anti-racist. By embedding anti-racism into curriculum, I aim to prepare nursing students to be clinically competent and socially conscious practitioners who can advocate for racialized communities. And beyond my professional role, my personal commitment to anti-racism stems from my broader values of social justice, equity, and community. I see anti-racism not just as an academic or policy-driven initiative or issue, but as a moral one that requires continuous reflection, learning, and action. And this includes participating for me in professional development activities, reading anti-racist literature, and attending workshops that challenge me to think deeply about my role in dismantling systemic racism. And I firmly believe that anti-racism work requires collective action, and I actively seek opportunities to collaborate with colleagues, students, and community organizations. Thank you.
Thanks, Janet. It's really wonderful to hear those compelling kind of commitments. Holly, would you like to go next and respond again to your relationship with anti-racism policy work?
Sure, thanks, Valerie. As mentioned, I work in the area of trauma-informed care, and part of that is creating the awareness of the prevalence and effects of trauma when we work with clients, families, communities, and then us as well as nurses. And part of that is identifying racism as something that people can experience as trauma. So whether that is the accumulation of trauma over time or from, an event or events. And we know that that can be on many different levels. So that could be on the individual level, the family level, within their culture, their community. We know that there's also intergenerational effects and that it could be historical or current. So also thinking about just some definitions, thinking about racial trauma and thinking about the emotional impact of stress related to the racism. We talked about today also the racial discrimination, race-related stressors such as the stereotypes, hurtful comments, the barriers to advancement that we've been discussing over the past few days. It can also refer to those incidents of racial discrimination on the ongoing points or the harmful or emotional impact of it that builds up over time. And people can experience that from something that happens directly to them or from seeing it happen to other people as well and being mistreated because of their race. So also thinking about it, it can also affect us as well from the media. So that racial discrimination, racism that we see in the media can also be upsetting to us, and reviewing those, can amplify kind of those feelings as well. And I also want to acknowledge within the system and in healthcare, there's, systemic racism, systemic trauma, and also re-traumatization from the healthcare system. So also wanting to acknowledge that and to put that out there. And we talked about the effects, many effects of mental health and physical health that can have, as well as experiences in healthcare, right? And whether that be accessing healthcare at all, or when people do access healthcare, how is that received and how do histories play into it? How does the current state play into it? And how do we make that hopefully a safer environment through our actions? So I was thinking of many different kind of examples, and we'll get into some of the actual actions, but even thinking, of someone not wanting to tell their nurse they're struggling or having difficulty supporting their child because they're fearing that their child will be taken away from them. So thinking about historically about residential schools in the 60s scoop, having birth alerts being put on people, having their children taken away from them. And we'll talk about that we know that happens a lot more within Indigenous populations and African Canadian and Black populations as well. So we want to acknowledge that is happening currently and today. Yesterday, a coworker was talking about using abbreviations of CPS, which stood for something totally different as a treatment. But the client and family thought it was Child Protective Services, right? And the effect that has on engagement of service. Within our system, a few years ago, a Mi'kmaq elder was telling us that they wouldn't be sending their child or their grandchild to a residential program. And why would that be? Because we were using in healthcare the language residential and the impact that has. And needing to change that, of course, in the healthcare system and how we need to do that and how the impact of that. And again, intent and impact, there is a huge impact. So thinking about that as well. And also thinking about a young African Nova Scotian youth that was telling their story about they were in with a broken bone and basically that they did not get pain medication, and their perception was because they were a tall youth, they were Black, they were bigger, and they were sitting someone next to someone who was white and was smaller, and they weren't getting the pain medication while someone else was. So again, people sharing these stories is definitely a privilege, but we also need to advocate and to do more with that. And I'll talk about that as we go through the next kind of how, we're doing that. And also the staff piece, I want to acknowledge too as nurses, and nurses are also experiencing this as well and telling, again, as an example, throughout the day, staff telling us that they're not receiving, the advancements, they're not even getting the interview or recognition that they deserve, and how that has an effect as well. So within my job as an advanced practice leader of trauma-informed care, my responsibility is to listen in those moments, to understand, to support in those moments, to validate, and to bring that action forward. And in the next few questions, I hope I can address some of that as well.
Great, thanks, Holly. So, so wonderful to hear sort of the comprehensiveness of your thinking. And just for, especially because we changed the time for the panelists to know, we still are aiming to end this part of the session at about 2:10. So just in terms of the responses to kind of hit the top of the wave so that we can get to hear all of you again per question. So thanks so much. So Dawn, over to you. So the same question again around your relationship with the anti-racism policy work.
So I just want to echo what Janet and Holly were talking about within their areas. And so I also work in my relationship with this work is always stems from home, where I came from and where I'm going. And, always, even today, I read information and I'm looking it up and I'm like, it's just words. It really doesn't mean anything until I put it in a story or hear a story, right? Which Holly had mentioned. And so, I think about there were so many examples from when I first left home, even living in home right up until today. So I'm going to share just a quick one. I had a nephew that was diagnosed with SCIDS. And before that, he stopped smiling. He was in another hospital. And right off the bat, they started investigating for shaken baby syndrome. And of course, that affected my sister. And we ended up at IWK and then was diagnosed with SCIDS later on. And the whole process of it, I'll try to keep it short, from even trying to get a DNR and her not understanding to the main part of what I want to talk about is the ceremony. She wanted him baptized within the Catholic and then also within traditional. And when we asked for that, it was no problem. We went right down to the chapel, a priest was brought in. But to get the traditional blessing, there was some complications and, things. In the end, we went outside with my nephew who was dying. And I always think about that, like that just sticks with me, right? And so, fast forward to a couple months ago, I had somebody from a young child from home that was dying. And of course, with this work, you learn that people are doing stuff, there's changes, and are these changes really happening? And so when I went into her room to visit the family, I saw a smudge bowl. And I even got goosebumps saying it. I saw a smudge bowl and I was so happy. And I was like, wow, because I knew about the smudge policy that was put in place at IWK. And so I asked the parents, oh my God, are you guys smudging? Like very excited. And they said, oh, well, we go outside. And I was like, what? We go outside? And he says, yeah, we used to do it at home every morning. And I was very confused because to me everybody should have known of the policy by then. You walk in a room, you see a cross, or you see, different significant cultural aspects of other people, but nobody recognized that the bowl was a significant piece for his family, which I told the nurse. And of course it was changed afterwards. And so, thinking about how it even affects today within this work, of really realizing there's still pieces of many policies that are missing where not everyone is included.
Thank you, Dawn, and thanks for those compelling examples and just the impacts too. So back to you, Janet. If you can share with us how you assess if a policy might be inherently racist, and we'll keep going on the questions. So maybe for all three panelists, if we can give one or two examples maybe, and then we can get to the big one, which is that one about the strategies.
Thanks, Valerie. So I like this definition that Dr. Kendi, he defines a racist policy, and I'll share this so that everybody hears his definition of what a racist policy is. And he says it's any measure that produces or sustains racial inequity or injustice between racial groups, written and unwritten laws, rules, procedures, processes, regulations, and guidelines that govern people. So assessing whether a policy might be racist, I think it requires critically examining its intent, structure, implementation, and outcomes. A policy, might appear neutral on the surface, but it can still have unequal effects on different racial groups or racialized groups. So I think it's important to look at the historical context. So does the policy originate from or reflect historically racist practices or ideologies? So policies that emerge from a history of systemic racism or are influenced by racially biased practices often carry residual inequities. So for example, admission policies in nursing schools might seem objective, still they would stem from a time when Black and other racialized students had limited access to higher education, indirectly reinforcing racial disparities in present time. In addition to that, we should also consider the decision-making processes. So I know yesterday, for those of you who were here, Dr. Etawa gave a very compelling keynote speech where she talked about the importance of having multiple voices and perspectives at the policy development table. So and I think we need to ask these questions. So who created and implemented the policy? Were racialized voices included and represented in these decision-making processes? So policies might be racist if developed without input from those it impacts the most, right? A lack of diversity in decision-making processes can lead to policies that are unaware of the lived experience of racialized groups. So when developing, for example, nursing education curricula, failing to consult, for example, racialized faculty or students can result in a Eurocentric curriculum that ignores racial health disparities. And if, for example, if nursing curricula focus primarily on Eurocentric medical models and fail to address the healthcare needs of diverse populations, they might perpetuate implicit biases. So it's important to look at, who is involved in those policy decision-making, who is at the table, whose voices are being left out, and whose voices are being included. And I'll stop there due to time. Thank you.
Thanks, Janet. So how about we go to Holly?
Great, thank
Next.
you.
Yeah.
And thanks, Janet. You had lots of amazing points. So I'll just add, I think it's first acknowledging that the policies are one of the foundational structures to build and sustain a racial hierarchy, right? So we're looking at that. And as well, I would say, how can we assess if it is if we're told, right, by the individuals and groups that it is? I think that's the other thing. People are telling us, like those first examples that I gave about, pain or certain words or certain practices that they're feeling that are racist, right? So then we need to be looking at that. One of the examples I was going to use kind of related to that is an example even in our health center we used to call a policy an apprehension policy, which was not a great name, and then ended up calling taking into care and caring for and thinking about, what does it mean to take into care? And again, thinking about, the histories and the higher incidence of taking Indigenous and Black, children into care and the frequency of that. And are we conscious of that in our nursing practice? And, are we putting, alerts on people that we shouldn't be putting them on? And does that need to happen? And would it happen to a white individual? And asking those questions to ourselves, right? Because some of these things are happening that should not be happening. And how do we support, if it is something that does need to happen, how are we supporting that, family, children, youth, the staff within that kind of heartbreaking and life-changing situation? So I think it's, again, the humanness of all this. And just to add, I think there's lots of great, as we're saying, lots of EDRA tools and policy lens tools and trauma-informed care lens tools that we can also share as well to help kind of guide that practice to make sure that we're having people as partners in the, initial stages of policy development.
Thanks so much, Holly. And so back over to you, Dawn, again, just how can you assess if policy might be inherently racist?
Well, Janet said exactly what I wrote down, which was who wrote that policy? And then of course Holly added to it. So yeah, I always think about when I see a policy now, to me it's like a rule book. It's like rules, and who are these rules made for, right? And so Janet had mentioned the admission policy within that, and just even what is involved in what you need, the requirements to get into nursing program, and it stems right back to the past where, our education system within our communities is different from the political system, and the funding is less, which means that we don't have the chemistry and biology. So right off the bat, we are missing what we need to get in. And when we get in, we usually get in at the lower, if they have a seat, if there is a seat, the Indigenous person may have a lower average, where everybody else has a 90 average getting into those seats. So, I always say this example of, a seat is a seed, but if you don't give it any water, sun, soil, it's nothing. It's just a seat, right? So, anyways, I'll stop there.
Thank you, Dawn, for that really important reflection around the seat and the individual and what they bring. Okay, so the next one I'm going to just kind of combine. So this is sort of what are some of the strategies for implementing and scaling up anti-racism policy work, and maybe a couple of key lessons learned with those strategies. So how about we start with Holly?
Sure, thank you. So I think first is really just, are we working together? So I know in my organization, there's so many people and teams and individuals that are really trying to act and trying to do things, and we often end up doing them very siloed. And that's what we noticed within my organization at a time, that everyone was trying to do the best that they could with what they had. But again, there were certain instances that come up. There was an issue with, microaggression. There's an issue with, not issue, but their staff were coming to us and kind of having feedback, and they were coming to trauma-informed care, and they were coming to equity and belonging, and they were going to person and family centered care or human resources or learning development. And we were all trying to do this and then collectively coming together to say, how do we collectively look at this, and really recognizing, we kind of developed an integrated framework of that to kind of say, there's definitely things that are unique about all these, departments and work, but also with trauma-informed care, person-centered care, and equity and belonging, there is overlap. And how do we collectively work together to really start looking at these issues on an organizational level? So some of the ways we did that was kind of, training about racism, microaggression. There was work on our respectful workplace policy. What happens if this happens and how it's investigated? How are people supported? What is the outcome of this? Lots of leadership training, and also thinking about, another example was identifying, and we had talked about the representation of our workforce, and there's discrepancies in employment rates of African Nova Scotians in our province and Indigenous and Mi'kmaq people with their own workforce, and how do we have a better representation with that in our workforce? So there was a lot of work collectively done of how do we do that? Like, we're saying this, we see it, we know that that's not the case. So how do we do that? So a lot of work was done with everyone collectively together to try to figure out how do we reflect the diversity that we need within our workforce, and we're working on that. within, our own positions within trauma-informed care and in leadership of, designated positions, and how are we even doing interviews, and how are we, really doing that in a more diverse way. And then we can get people within our system, but how are we really respecting that and helping, to create that safety to help to retain, right? And if we think about nurses, how are we retaining nurses? So I think they were some pieces that we really put some focused time and continue to do, as we know this is not a one-time, checkbox. This is, we need to keep doing this. We need to keep improving and figuring out ways to do it. So I'll stop there on that one, but that was an example.
Great. Thank you, Holly, so much. Back over to you, Janet, just in terms of the strategies for implementing and scaling up and some key lessons.
Thanks, Valerie. So strategies that I can think about, I think when you're implementing or scaling up anti-racism policy work, I think it requires strategic planning and continuous engagement with collaborators. So for example, we need to have institutional buy-in and leadership commitment. I think that's a very important strategy. So institutional leaders and decision makers must champion anti-racism policy work. So in the academia environment, it could be the presidents of the organization, the deans, the managers, the department heads, program coordinators. I think gaining commitment from top leadership is critical for securing, for example, resources that you need, legitimizing the work, and ensuring that anti-racism is embedded in the fabric of the institution rather than treated as a temporary initiative. So during implementation or scaling up, I think it's important to present evidence of the importance of anti-racism policies, particularly how they impact student or patient outcomes, institutional reputation, and compliance with accreditation or legal standards. And we need to advocate for clear leadership statements and actions that publicly commit to anti-racism. Another point that I could share. So we might have a policy, but how do we know that it's effective? So it's important to look at data collection and accountability mechanisms. So this is something that a strategy that I think is also important. So we should use data to assess racial disparities and monitor the effectiveness of these policies. So data collection allows institutions to identify what the problem areas are, set goals, and track progress. And we also need to establish accountability mechanisms to ensure that policies are followed and outcomes are measured. So during implementation, it would be good to regularly collect and analyze data on key areas such as admissions, retention rates, student satisfaction, faculty diversity, and using accountability frameworks as well, such as improving racial equity or increasing racialized faculty hiring, or improving retention rates for racialized students is also important, and good strategies or great strategies that we can use when we're implementing or scaling up. And I'll stop there.
Thanks, Janet. Lots of great strategies to reflect on for sure. Over to you, Dawn. The same question and kind of the combination of the strategies and the lessons learned for scaling up anti-racism policy work.
One of the number one things is we need to be there. We need every different background in these areas to help guide these policies. And as for Indigenous part, there isn't enough of us. And so, one thing I noticed when I started this work, and I used to tell Dr. Landmer, like, I'm the only Indigenous person. Why am I the only Indigenous person? And it was like in every meeting. And I started to become insecure about that, in the sense that I'm speaking for my people, but I haven't even lived there for over 20 years, and so I needed that perspective. But then at the same time, there's many people that are not comfortable in these areas to speak up or say anything, right? So how do we bring the people in that need to have a voice and feel safe that they can have a voice? There's been times where somebody has mentioned racism that, at that point where something has gone wrong, and they said, oh, well, they never mentioned it before. And that's that environment where it's that power struggle. Of course, they're not going to mention it before. They're only mentioning it because they're finally comfortable enough to talk about it, right? So one of the, I believe, strategy for that is like to always talk about racism and kind of what it is, to allow groups to call it out when they see it, right? So, and especially with Indigenous students first coming into the schools, right? I think back with my education, and I'm like, there was a lot of racial things that I didn't really acknowledge until after I left and I started working, and and that continued. So, um, allowing a space for it to be talked about.
Thanks, Dawn. Really important reflections and experience. And what I think we'll do now just is let's move over to the Mentimeter so we can engage with all the participants and you can hear from them. So I think Khadijah's going to help me out here. So if you have questions also for Dawn, Janet, or Holly, please scan the QR code and submit them now as well. So that we can engage in a discussion and you can either identify who you're specifically addressing and or we'll have some of different respondents provide their perspective. So just give you a second. I know it takes a little bit and also the word language is there on the chat for getting into Menti again. So here's the first question. It is always very, very difficult to articulate to upper management that you feel you're experiencing racism or being racially discriminated against. Can you offer any advice on how one can work through this process? Janet, do you want to take a first stab at it?
Sure, thanks. Thanks, Valerie. I was just reading the question on the screen. So I think this is a really good question, and it is difficult to sometimes to articulate when you are feeling or experiencing racism or being racially discriminated against. And what I find when this happens, and at times, you feel that anxiety. There is that you feel, you don't have the power or the strength to talk about it. But I feel it is important to bring this up and to look at what are the supports that are in place in the organization to help support you. There are usually supports that are available to help to give you that support so that you feel as if you have a peer or talk to your colleagues as well who might provide that support so you feel that you're able to go and talk to management about it and so that something can be done if you're experiencing racism.
And sorry, it looks like, I'm sorry, I didn't read the fine print that we're just having a bit of an issue making sure we're catching up with questions here. So give us a second. I bet that was a wonderful response, Janet, and so critical. Okay, we've moved on to the next question. Here we go. Have you encountered agencies that have policies and the monitoring is not really in place? How about Holly take a first cut at the response?
Yes. So I think that's a big part of it. So these policies may be, there, but either they're not always followed, or not always monitored, or what is kind of, how are the policies doing? Like we said, it's great to have them written, but what is really happening with them? And are people following through? And do people have enough support and education and time to do it and all those kind of pieces? So, yes, I've definitely, heard from people and individuals, it isn't, but I've also heard from other organizations that it is as well, our teams. So, and monitoring again is getting that feedback and getting feedback from the people that it's affecting in the communities, right? So it's also making sure that we're getting the right feedback from the people that are actually experiencing it and taking it in and saying, okay, well, we hoped that it would have this impact, but it's not. And then how do we go about it? So I think it is that continuous improvement approach to say, how do we do this? How do we do it in as much of real time as we can so we're not impacting or harming other people in the process as well?
Great. So how about we go to the next question and this one's a nursing education one, so maybe we'll put this to Janet first and then Dawn, I'll get you at the next one.
Okay, let's see if I could read it. There's something that is kind of blocking part
Okay,
of it, but
sorry, I'll read it out loud. In nursing education, when considering clinical failures, or pulling students for safety, how do you go about differentiating between an instructor who is discriminating and it being a safety issue?
So this is another great question, right? So when considering clinical failures, which does happen, or pulling students for safety, which at times this you find that happens as well. So how do you go about differentiating between an instructor who's discriminated and safety? And I think you got to look at, is it really a safety issue? Or is it somebody who is discriminating, or being racist against the student? And again, it's looking at the data, I think, what is happening. Now, and I've taken students to clinical in my career where there can definitely be safety issues. And I think it's look, what is the data showing you? Is the student, exhibiting behaviors that are unsafe? And I think that is important to kind of differentiate versus, is the clinical instructor just being is discriminating against the student? And it's not an easy, I think when it comes to patient safety, it's not an easy thing to just say, yes, this is happening or that is not happening. Because I think it's important to look at the safety as well. And then hearing the student, what are they experiencing? I think it's important to hear from the student, what is going on? What are they experiencing? Look at the evidence. What is it showing you? Because these are two important issues, patient safety and also being discriminated against and experiencing racism. So I hope that answers it. It's not a clear cut, but I hope that does provide an answer.
Thanks so much. So Dawn, this is for you now, and I'll just read it just to make sure you can see. Thanks so much, Janet. How can you effectively implement and evaluate anti-racist policies?
I think you need to review them more than once and have the different voices to ensure, because when you review something just a couple times, you don't really think about how it's really affecting you and your culture and other people's cultures and patients and students, and um, just going back to even the safety part of it, and you know is is the person safe to come out to really discuss the policies that are affecting them, right? So I think that always bringing it forward, it's uncomfortable. I know I make people uncomfortable when they see me because it's like I'm usually presenting an issue, right? But for everyone to be open to hear that and to really understand it from everybody's point of view. So
Nothing about us without us, and having that
it's
level of engagement. Thanks so much, Dawn. So maybe I'll just open this up to the panel, and once I read it, who would like to take it? Many of us who are visible minorities know what is going on, in brackets, racism, and the establishment holds on to their position. What can we do when issues are brushed under the rug? It can wear you down. Does someone want to take that first? Janet, do you want to go first? I saw your
Sure,
hand move, so I thought maybe go first.
I could give a shot at it. And thank you for this question. I think it's important as well to talk about, right? Um, a lot of times we see issues are brushed under the rug. They don't want to talk about it because it's uncomfortable or that, yeah. So, anyways, but I think it's important to bring it forward. I think it's always important when things are brushed under the rug to highlight it, to keep going, and to pull it from under the rug and to bring it out into the open. And a lot of times, I know it takes strength, it takes willpower sometimes because we are usually in this vulnerable position where you think you might lose your job, or it's based on what are others going to say. So but I think it's always important to bring it out, to talk about it. Again, look for those people who are there to support you. Look for those critical allies. We heard about critical allyship yesterday, who are there to help, for you to bring this forward, to bring it out, and to make sure that it's addressed. So I think that's what I'll share with that.
Thank you, Janet. And it's so critically important. And when I served as a vice president and chief nurse, and I remember once saying that a particular patient outcome was related to racism and the pushback I got at that point in time, even from the senior team colleagues, because they just have that unconscious and conscious bias that they can't see through. So it's so critically important that every single person is feeling courageous to challenge each other. So thank you so much for that reflection. Okay, so maybe we're going to do a couple more, and then we're going to get to questions from each of you to the attendees. So any questions on gently pointing out to other recent foreign trained nurses about their racist attitudes towards other cultures? This one's a toughie. Does anybody want to take this one on? So they're sort of gently pointing out to other recent foreign trained nurses about their racist attitudes towards other cultures. And there was a similar question yesterday, but just I'll leave it to one of you to respond, or Dawn?
I'm looking at this question and I'm thinking the opposite, because there's a lot of racism that the foreign nurses are really facing, right? But yes, they come to our country with their cultures, and sometimes their cultures do not our Canadians are not really recognizing that that is just how their culture is. One of the ways, I think personally, I feel like for myself anyway, when people find out I'm Indigenous from a foreign area, they want to know about me. And so I think sharing who we are and our culture, and it doesn't have to be me, it could be, a Scottish culture, like sharing your own culture and your own even values kind of helps gently guide them into what is the culture within that they're treating. You know what I mean? It's not just Indigenous, but Black, and what is the culture they're treating. So sharing your culture with the nurses.
Thanks, Dawn. And yeah, just it's all about just that having a conversation together, and the whole conversation we've been having about listening and understanding, and coming with that positivity that was reflected in the land welcome today, and that energy. So thank you. Holly, this is the last open question, and any of the other questions, just to the participants, we'll review them with the panelists offline, and continue to engage in this dialogue. So this is, so unionized jobs have strict rules for hiring or interviewing, but if you move into leadership roles, the rules are less strict, allowing for handpicking. Please comment.
Yeah, so that is sometimes a reality that our unionized jobs, again, as you're saying, have strict rules. And then if it's non-union management jobs, they don't always follow, of course, the same kind of rules. So I think it goes back to what we're saying. If we're noticing that, and I guess it goes back to having a conversation to point it out in a way that's kind of factual, but to say, I'm noticing that we're not having more diverse representation within our roles in leadership, and how do we do that? And as an organization, that's something we're also looking at and have done and need to do a lot more of. So I think it is kind of saying that, because it's factual that we're not seeing the diversity within the leadership, and how do we then help to create more diverse leaders and roles, because we know really that's one of the main ways that we're going to see a difference within nursing, within healthcare and changes, is that, right? That is one way that we can do that. So I think it is kind of naming that, and then again, really trying to find ways to action that. Like, what are we going to do with that? How do we do that? So that would be one suggestion.
Yeah, Holly, and I think the three of you so brilliantly talked about the policies and just the importance of the HR policies around diversity applying to all levels and all roles within organizations, and holding senior and governance level individuals accountable for that. So thank you. So we are actually going to move away from the questions here to questions from each panelist, and we are starting with Janet. So Janet, are you prepared with your question? Just because I don't know what you can see on the screen. Yeah.
Thank you. I think it's showing up on the screen
Okay,
here
good.
too.
Good.
So I'll just read it out. So have a reflective question for the audience. So what are some of the policies at your work that could be racist or anti-racist? Could you provide some examples? And we're using the Mentimeter for this, I believe.
We are now moving and still using Mentimeter for sure. So if you, it should be open. I just want to make sure with Khadija that we've got that open still for the responses to come in.
Yes, we are open and have responses starting to trickle in, and the code is at the top.
Thanks so much, Khadija. Thank you.
Okay, this is great. We'll just wait for some more to come on in. I'm seeing the one that I had thought about when I was doing my presentation was around the dress code policies, right? We in nurse, for example, in nursing education and even in clinical practice, we often hear about dress code policies sometimes being racist or not being inclusive. And so that's a really good one to highlight here. I see it again. Strategic plan does not embrace the full workforce. Registration practices. Attendance policies. I like this one that says one size fits all cohort approach to education. For sure, there's never any one size fits all, no matter what you're doing. We're all have unique abilities. We're all different. We have our intersectional identities. So one size definitely can't fit everyone. Admission policies, stat holidays, access in language and translation. Leadership is not diverse. Grading, biases, EDI policies, not being diverse in hiring practices. Being able to take holidays or time off. Patient education policies. So lots of different policies that are coming through. So thank you all for highlighting these and for sharing them with us.
Yeah, such diverse answers and definitely will enrich the output and summary from the two sessions today and yesterday. So Dawn, could you ask our attendees the next question? On mute, sorry.
I always start with like, you can't care for a person if you don't care to know them, their beliefs, their values, So how would you fulfill your responsibility to know your patient and colleagues' values, beliefs, and culture? Ask questions, active listening, approach people. Curiosity, yes. Engage in open conversation. Listen without judgment. I hear a lot. I see a lot of listening. That's great. Education. Don't assume. To understand. And I'm just going to reflect on this. Do your homework. I had a client one time that was getting porridge every morning. And, we just noted in our chart that she wasn't eating her breakfast. And, once having a conversation, you realize that this person was a residential school survivor that was given porridge every day, forced to eat porridge. And, knowing that background about your patient, and also like offer something else. If they aren't eating anything, you don't have to ask, why aren't you eating it? Would you like something else? Would something else work better for you? So have an open mind, do your homework. And part of the homework too is I always talk about not I wasn't educated about this history as well growing up in my community. You just live it. And it wasn't until I left my community that it was the stereotypes that were actually presented to me about having a free house and never paying taxes. And those were, I was like, where are people getting, why do people think this, right? And where's my free house? So anyways, I always make a joke, like I had to start educating myself on why people thought this way. And, you know, and taking that education and really using it to help others understand the reality. So be honest about your own lack of knowledge. Thank you.
Thank you, Dawn, and thanks for sharing that compelling example of an individual and that institutionalization and even the meaning of food and how important it is that we explore with our patients and clients. Okay, so I'm going to turn the last question over to you, Holly.
Great, thank you. So we were hoping you could think about what can you do, and I'm going to say in the next day, week, or month, well, maybe we'll go that far, to promote anti-racism policy implementation in your workplace. So we're starting to get some answers up here. So dialogue with student as key partners, yep. Ask questions, yep. Be respectful. Share attendance. Yeah, I was thinking of that too. I was thinking, oh, it could be something. Definitely sharing attendance, saying like, you know, it's opening the conversation. Hey, I attended this CNA anti-racism summit, and this is what we were talking about. Get the discussion going, and thinking about like how do we do better? What are we doing? What can we do? It's great. Okay, very active from some of the suggestions that we had from earlier yesterday, I think it was. So I just sent an email to see if we can adjust our aftercare sheets to change redness to color change. Yeah, great, right? So these are like practical things that we can change now, so thank you. Policy review through the EDRA lens. Yep. Open discussions, become more involved. Thinking about training, speak up. Yeah, that's definitely one thing that we can do, you know, right away is, you know, if we're noticing that to speak up and say, hey, that, you know, that is racism and how do we move forward? Sharing those stories and policies with others, working with human resources, educating and using our voices, and no longer, this person is saying, no longer minimize my Indigenous background. Thank you for sharing that. Share what I'm learning with my coworkers and management, take what I've learned, share, initiate. Yeah, it's great. Helping to revise land acknowledgements. Yep, great. Thank you. Yeah, so I mean, so there's lots of things, right, that we can do. And thank you for sharing all these suggestions. And I'm sure no one that put these up is, you know, keeping them themselves. So please look at the other ones too and say, hey, yeah, that's a good suggestion. I can try that too. So there's many different things I think that we can take away from today. So thank you all for sharing those.
Thanks, everybody. It's amazing to see your expertise and insights coming through and having that conversation with the panelists. And so now an incredible special thank you to Janet, Dawn, and Holly for the wonderful panel discussion and how to transform policies to be more equitable and anti-racist. It was clear when you were communicating where, you know, some of the words that were aligned around systems, structures, policies, you know, courageous leadership and the ability to actually have our voices heard at all levels of an organization, equitable HR practices were all coming through in all of your different ideas and so many lessons learned from each one of you. And I just want to thank you on behalf of all of the attendees for these incredible insights.